There's an epidemic across all corners of the profession of frustration among physicians with their work. Now, why is that going on? We tend to think it's because of bureaucratic interference. It's because of declining reimbursement rates. It's because of decreased professional autonomy. But I think that the profession has been ignoring the possibility that at its root, the discontent that physicians feel now that leads to what we call burnout, that leads to primary care physicians leaving the field of primary care in droves, people trying to reduce the amount of time they have to spend with patients. That discontent expresses a deep sense that what physicians are doing now is no longer really medicine.
I was part of a study looking at the role of spirituality in the lives of medical residents, specifically with regard to burnout and depression. And sadly, the rates of burnout, depression, and suicide are very high among physicians, medical students, and residents. And in that particular study, my colleagues and I found that residents who had some sort of spiritual belief, value, or support, and again, this is broadly defined, tended to have lower rates of depression and burnout.
You know, with all your training and all your technology, people die, they get worse, they suffer, and you can't do a thing about it. That creates burnout when it's just a job. If it's a calling, it's different. The calling part of it, the spiritual part of it, is what keeps you going. It's what gets you up in the night, gives you the energy, the motivation to do this.